Hello, my name is Emily, and we're here today to discuss the topic of hypothyroidism. And we also have a special guest appearance, Natasha, to discuss some of the symptoms and what their everyday life is like living with this diagnosis.
Hello, my name is Diana, and I will be interviewing Natasha alongside with Jessica. And here comes Natasha.
Hello, my name is Natasha. I'm here with my parents. Their names are Brett and Graham. I have been clinically diagnosed with hypothyroidism.
Hello, Natasha. My name is Jessica. It is very nice to meet you. Is it okay if my colleagues and I start off with a couple of general questions about hypothyroidism? And then we'll just focus on some more in-depth questions about it. We just want to help bring awareness to hypothyroidism and learn about some life modifications that an individual can do to allow an easier daily living with this diagnosis.
Yes, that sounds good.
I would like to start off asking, what is hypothyroidism?
Hypothyroidism is an insufficient circulation of thyroid hormone as a result of various abnormalities. Hypothyroidism can be primary, which is related to the destruction of thyroid tissue or defective hormone synthesis, or it can be secondary, which is related to the pituitary disease with decreased secretion of thyroid stimulating hormone, or hypothalamic dysfunction with decreased secretion of thyrotropin releasing hormone.
Thank you for that very in-depth explanation. Diana has some questions for you now, if that's all right.
Absolutely.
How long have you had this diagnosis?
I've had this diagnosis for about 3 years.
Having this diagnosis for 3 years, have you noticed any change in your physical or mental state?
Yes, I've noticed early on before my diagnosis that my tolerance for exercise was lower than usual and that I was having shortness of breath with exerting myself, sudden weight gain, and cold temperatures became intolerable.
We also noticed that she was having some mental changes in terms of impaired memory and slowed speech.
And she was also having decreased initiative and was sluggish when doing regular activities throughout the day.
Are these classified as signs and symptoms of hypothyroidism?
Yes, the shortness of breath, sudden weight gain, intolerance to cold temperatures, and sluggishness are all signs and symptoms of hypothyroidism.
And was there anything that the nurses explained to you in detail when you were in the hospital about hypothyroidism?
The nurse explained that the fatigue was caused from the metabolic rate slows down. There's a lack of T4 and T3, and it's due to the iodine deficiency. And that T3 regulates metabolic rate, also a decreased cardiac output and decreased cardiac contractility, which make it harder to perform activities of daily living.
They also explained that the classic symptoms of hypothyroidism, such as fatigue, sudden weight gain, and cold intolerance, are all anxiety-provoking for the individual.
Did they discuss any specific care plan with you while you were in the hospital?
They discussed with my family members and I about the overall goals for my care, and they were to experience relief from the symptoms that I was exhibiting, maintaining a euthyroid state with medication, maintaining a positive self-image, and adhering to a lifelong regimen of thyroid replacement therapy.
If you don't mind me asking, what was the medication that they prescribed you to maintain the euthyroid state?
They prescribed me levothyroxine, which is the drug of choice to treat hypothyroidism.
They also recommended she go on a low-calorie diet to promote weight loss.
Were there any home care teachings that the nurses informed you when you were in the hospital?
The nurses explained the importance of taking the medication continuously and that there is a need for lifelong drug therapy. They also explained the need for regular follow-up care and the need to contact a healthcare professional immediately if signs of overdose occur. These signs can be seen as orthopnea, dyspnea, rapid pulse, heart palpitation, nervousness, or insomnia.
The nurses also emphasized the need for a comfortable and warm environment because of the cold intolerance.
Yeah, and they also taught us how to prevent skin breakdown, which can be seen as using soap sparingly on the skin and then applying lotion afterward.
On behalf of Diana and Jessica, we would like to say thank you and your family for taking the time today to speak with us about hypothyroidism and how it has affected your day-to-day lifestyle.
Welcome. We were glad to speak with you today about hypothyroidism to help bring awareness to it and what signs and symptoms to look for.